Hello everyone, my name is Aisha. Today the topic that I'm going to discuss with you is ischemic stroke. Firstly, what is an ischemic stroke? It happens when there is a lack of blood supply to the brain due to blockage of an artery or a rupture. It is considered as a medical emergency. The clinical manifestation that I have chosen is right-sided weakness. In the case study, Mr. Mark came to the emergency department after waking up with weakness on his right side, together with right facial droop and difficulty in speech. According to his family, he suffered from hypertension since 2 years. He was diagnosed with left MCA, middle cerebral artery, ischemic stroke. Thus, due to ischemia, that is less blood flow to the body parts, there is damage to the brain, as it is deprived of oxygen. Also, it happens when bleeding occurs. A complete MCA distribution infarct will produce contralateral hemiplegia and hemianesthesia. Also, difficulty in walking, speaking, and possible paralysis of one side of the body. Pathophysiology underlying this condition is caused when there is injury to the left side of the brain, which controls language and speech, such as the case with Mr. Mark. Most common causes of ischemic stroke, which happens due to blood clots. The MCA and its branches are some of the most common sites of occlusion and infarct. There is a large part of the brain which had inadequate blood supply, but can improve if treated in time. This part is known as penumbra, and its effects, the vision, can cause fainting and nausea. If left untreated, it can go irreversible infarction. As the facial nerve is affected, the face droop on that side as well. Moreover, ischemia can also happen due to thrombosis. That is blood clot in a blood vessel, embolism, blockage of a blood vessel due to blood clot. A decreased blood flow in a part of the brain. Ischemic stroke can cause damage to the brain and even cause death if not treated quickly, according to Holland 2018. One high nursing intervention to improve the patient's clinical manifestation is to monitor respiratory system. The main aim to maintain an appropriate airway and, if needed, supply oxygen. Usually, stroke patients, without being aware, due to anxiety, may hold their breath, so we must reassure them. If there is difficulty in breathing, assure that there is no tight clothing as well. When breathing is proper, it may help Mr. Mark to cope with his situation. The breathing affects the circulation, according to Virani et al. Patients who suffer from stroke, as is the case with Mr. Mark, can have disabling symptoms, neurological deterioration, airway compromise, and blood complications, thus leading to the disability which Mr. Mark has. Oxygen is very important for survival, and it is the blood which carries oxygen in different parts of the body. The brain needs constant supply of blood to function properly, and constant supply of oxygen and glucose is important as the brain does not store much glycogen and adenosine triphosphate. It preserves the structure of the cell and helps muscle to contract, so a good supply of oxygen and ATP will help Mr. Mark to improve his disability. Brain damage caused by stroke can have an adverse effect on respiration, causing breathing disorder, maybe due to weakness of the muscles and chest movements, thus deteriorating the function of ventilation. Recent studies shows that a single session of intervention, it stimulates through proprioception, neuromuscular facilitation, works well to improve airflow in the respiratory tract. So dear audience, I tried my best to explain what are the ischemic stroke and its consequences. Also the effect of proper breathing and the power of oxygen to keep every part of the body alive. I conclude with the quote of a famous Confucius. Our greatest glory is not in never falling, but in getting up every time we fall. I would like to thank you so much for this opportunity, and thank you.